Social workers are an important part of the healthcare team as we serve the patients as a whole person along with the doctors, the nurses, and all the rest of the staff within the hospital. We work with finding what your strengths are and work with that as well. So inpatient social workers provide support and help the families cope during their inpatient stay. They provide them with the equipment and they prepare them for their home recovery or home care services. On the outpatient side, we help the patients when they come to visit their physicians. So it can be stressful to have a new diagnosis, especially for the families when it's a chronic condition, and it's kind of providing the support individually and more education around it and kind of normalizing it for them. As we hear it all the time, for families it's kind of shocking. So when they come to HSS to seek their care, we invite them with a warm welcome and provide them with support. We listen to what their concerns are, especially if they're diagnosed with a new condition. And we just take the time individually with them. And I feel like that's very important. I feel like it's taking the time to getting to know the family and being there for the family and building those relationships not only with this as a social worker, but with their healthcare team. Because they will continuously come here for their care. So when patients and families come to see their doctors at their appointment, we encourage them to ask questions, especially if they have a new diagnosis or they're indicated for surgery. We help them with finding resources in the community. We help them with things like transportation, home care services, any school-related concerns if they have, questions about their insurance. So we, as this team, I feel it's important that we have strong communication. We work very closely together and to keep each other informed of any issues related to the patient so they have good health outcomes.